Hi everyone, my name is Ying Xiao. So today, this presentation, I'm gonna share with you my experience of interviewing the informatic specialist. Her name is Heidi Fronda. She's currently working in Stanford Healthcare Hospital as an informatics senior program manager. So her experience, she worked in different area in nursing. She currently having MSN degree. So in her earlier nursing career, she worked in ICU for 10 years at Satter CPMC. Is also a well-known facility. So that 10 years, she gained a valuable experience in ICU nursing. After the 10 years, she decided to explore something outside of the ICU. She switched to a case manager position and worked for 7 years. Because that position was a flow case manager position, so she got a chance to learn something outside of the ICU, including the healthcare continuum from the point the patient seek care come to hospital to the discharge, going home, and the insurance part, everything. Additionally, they also had a chance to join the quality and the informatic committee. She joined a project called Epic Optimization Campaign Project, and she worked there for 6 months. During that project, she discovered her passion in nursing informatics. She went back to school and get her Master Science of Nursing degree and started working as an informatics specialist. So I was asking her what's the value of informatics as a driving force in delivering of nursing care in Stanford. And she told me nursing is actually is part of the foundation of the nursing, because nursing uses data to track performance and the quality of care. For example, in my unit, usually we will receive the monthly update from the management team regarding our performance and quality. For example, what is the medication scanning rate, and what is the rate of charting the patient's pain assessment before we giving pain medication. All those is data driven. We use data to collect the information, use data to display, to share with others about their performance. With data as a foundation of evidence-based practice, data is also crucial in monitoring how many numbers of fall, determining necessary flow sheet requirement, and enhancing the user, which is healthcare professionals, especially in nursing, to measure how much time they spending in charting. So they also can evaluating the current documentation burdens. For example, one thing surprised me is actually informatics department, they track what is the average time a nurse is sitting there for charting. And based on that result, they will develop some function that reduce the burden of charting. They also develop some customizing healthcare electronic health record function to meet the specific need for individual department. For example, when a nurse come to the Pixas to grab a medication, sometimes it's narcotic medication. Whenever someone grab that medication, the Epic system will generate an automatic reminder, so that nurse will see that reminder show up on her the brain, the electronic health record brain, so she know she need to give that medication, or she need to return that medication if she didn't give to. But for some department, they may not need this function. So informatic nurse, they can develop functions that meet a unit specific needs. And we also in Stanford, they also use medication scanning, smart medication pump as a safeguard. They use clinical deteriorating tools, best practice suggestion as part of the decision support. So they also use, for example, like telemonitoring, and they also use the Volt medical communication app to enhance communication efficiency among the healthcare member. So smart IV pump integrated into Epic electronic health record system is also improve the accuracy of the medication dosage. So quite a lot of people depends on informatic department to collect high quality of data. So for example, nurses, educators, and management, they all use those data to support their daily work. For example, nurses we can collecting data, track the change in nursing performance, so we know the quality of care, how we are doing currently. And the management, they also require data for plan for any policy change. For example, how the data can tell us how much impact if they implementing a policy change. Nursing education can use data to check which area that they need to develop and provide education to nurse to meet the nurses' need. So healthcare Stanford Hospital is a Magen hospital. So Magen Hospital, they have emphasized commitment in excellence in nursing care. Informatic nursing also supporting the technical innovation. They wanted to enhance the patient safety and the streamlining workflow for the healthcare providers. She also shared with me that a lot of people, they misunderstand that informatic nurse, they are IT. Actually, she told me, she said, we are not IT. We work with IT, but we are still nurse. So she shared with me, like here, the IT department, they actually building up the function, but informatic nurse telling the IT what type of function is needed. And for example, if they receive 10 ticket, 10 requests, informatic nurse can tell the IT department which one is most urgent request that need to be addressed, and also they can know how the function change can improve nursing care. One thing I asked her, I was very interested in what qualification or ability or does a bedside nurse require to, if someone interested in switching a career to informatic nurse, except the education part, because we already know the education part require master degree and a special training. So she told me for someone who considering career change to nursing informatics, this should be per se a strong desire to enhance workflow efficiency and improve the current system. Additionally, they also should demonstrate critical inquiry skills. Sometimes, nurses feel hesitating about asking questions, but as an informatics specialist, they need to constantly discover a question and ask a question and seek for a solution. She also shared with me about a lot of challenging they are facing. For example, when they wanted to implementing a change, they often hear from the team member that this is the way we get used to do it. We do it this way, and the team member, they hesitating about change. I think after completing this interview, I realized actually our work is not like it's not. We are the partner of the informatic nursing. We are part of the informatic nursing because our bedside nurse performance provided data and feedback to the informatic nursing to process the data, to develop a system that supporting our work to improve the quality of nursing care. So also I feel as a master prepared nurse, when we doing our daily work, we should be able to have the ability to discover the current need in the unit, monitoring the needs and seek solution for building a better system. For example, I don't know how to build technical things, but at least I can submit a request and communicate with the informatic department and work together to seek solution to improve the system and improve the quality of care we delivered. Thank you.